On this podcast on the Back Pain Rant, I'd like to talk a little bit about how to avoid a fusion with endoscopic spine surgery. I'm Dr. Tony Mork, orthopedic surgeon, endoscopic spine specialist. And really, I think that when I left the spine group that I had been with for 10 years back in the late 90s, the charge to myself when I left was I wanted to essentially explore the limitations of what surgery could be performed to relieve back and leg pain without doing a fusion. I think that the office that I was working in was kept, like many or most spine offices today, are oriented to perform a fusion for back pain or leg pain issues. And the question is, maybe they don't really need to be done. There are several reasons that fusions are done with such a high percentage of cases today in the United States compared to other places. And I think my charge back then, after seeing so many of them performed and seeing how they actually did post-operatively, I think gave me a reason to try to think of some alternatives to lumbar spinal fusion. So one thing is that I think the spine is supposed to move. The question is, how much? So the instability is oftentimes used as a reason to do a fusion, but I think the spine is supposed to move. It's a matter of how much it's moving and whether that motion is really causing pain or not. So endoscopic spine surgery can be used to treat a large number of problems that I have seen treated with spinal fusions as a first kind of order of treatment, whereas I think endoscopic spine surgery should have been something that's a much lesser level of treatment that could be initiated first and maybe very successfully. I think that fusion surgery, where you're going to take something that's supposed to move, the spine, for example, is really not a good idea to fuse because those forces will be conveyed to other areas if you fuse a level. So for example, if you fuse lumbar 4 or 5, the forces that used to be, the motion that used to occur at 4 or 5 will have to occur somewhere, and it will be transferred to lumbar 3, 4 and lumbar 5 sacral 1. And this kind of sets things up for the what they call adjacent disc disease, which then move excessively and then generate the same type of wear and tear issues that the fused level did. So that's why you see people having to extend the fusions with time, because you're eliminating the motion, which is going to occur somewhere. And if it occurs at a place where excessive motion is required, then that will probably have to be fused. So again, when I really decided to embark on this endoscopic journey, one of my main promises to myself was that I would never do a fusion, and I would see to what extent I could eliminate the need for a fusion using endoscopic spine surgery where motion is preserved after the surgery. Indications for fusion are really pretty limited: trauma, tumor, deformity, gross instability. Those are all reasons, and I think very legitimate reasons, to have a fusion, but those reasons are not the typical reasons that fusions are performed today. So I just wanted to point out that endoscopic spine surgery is a way, by sparing the motion and sparing injury to the soft tissues that support the spine, this is a good way to eliminate the need for a fusion. And so many different problems can be treated with the endoscopic approach to this, with really minimal soft tissue damage and really minimal kind of, I guess, alteration of motion. That endoscopic surgery really is a terrific way to start in the event you do need a surgical procedure. As I said, reasons for doing a fusion are really well defined: tumor, trauma, deformity, like scoliosis, and then, of course, gross instability as well. But other than that, I'm not so sure that fusions are really that great of an idea, certainly not to start with. Endoscopic surgery offers options as you go forward. In the event it doesn't work or it was not relieve enough of your pain, you can always have a fusion or disc replacement as a backup, but probably not the best thing to start with. So thanks very much for listening to this short episode on just my philosophy about fusions. And I invite you to subscribe to this channel and ask any questions you might have that I could try to address in a future podcast.